Well, good afternoon, ladies and gentlemen, and welcome to the public board meeting of NHS England. The observant of you will have noticed that I am not Professor Sir Malcolm Grant. He is ill, and Malcolm, we wish you all the very best. I'm assured we will have at least one person watching us on the webcam, and I will undoubtedly get a performance review afterwards. But anyhow, if you welcome to our meeting. I have an apology from Margaret Casely-Hayford, who unfortunately is unable to join us through a conflict in the scheduling. There is, as always, no fire alarm test due this afternoon. If the fire alarm does sound, then the board support team will escort all of us to a safe place and count us to make sure that we're here. And that we've made it. So welcome to the meeting of the NHS England board in public. We have I think a full and very important agenda with, alongside our normal reporting, we have both the mental health task force findings and also the consultation, the results of the consultation following the Cancer Drugs Fund work that has been ongoing for some period of time. Before I move into the formal agenda, can I just ask if any members of our board wish to declare any agenda items where a conflict of interest may occur, or to raise any new declaration of interest which has not already been recorded? John.
In my professional academic capacity, I'm currently acting as an advisor to AstraZeneca on one of their new cancer drugs, which doesn't directly impact, but is obviously relevant to the cancer drug fund issue.
All right, thank you, John. So,
I'm a company member of Cancer Research UK.
Right. Okay. Thank you. Can we now move to the minutes of the previous meeting? Do any board members have any comments on the minutes? May I sign them? Thank you. There are no matters arising from those minutes that are outstanding. Simon, Chief Executive's report, which I understand is an oral report.
It is, yes. Thanks, David. So it's less than a month since we last met. We've got most of the items covered elsewhere on the agenda. So I just want to really place on record thanks to several people for important work that's been done since we last met. First of all, as we will be discussing later on, the final report of the Mental Health Task Force, chaired by Paul Farmer and Jackie Dyer, launched with a great interest on the part of the whole of the National Health Service, but also local government, patients groups and others. We've got an item specifically on that, so I will say nothing other than to place on record our thanks to the task force. Similarly, this week we have published the independent maternity review that we commissioned, and that group has again done an outstanding job of bringing together a diverse range of stakeholders, including parents, campaigning groups, patient safety advocates, the Royal College of Obstetricians, the Royal College of Midwives, and come up with some tangible propositions as to how to improve the safety and the responsiveness of maternity services for the 660,000 mums who give birth in England each year. We will, at subsequent meetings, and in particular in March, in the context of our business plan for next year, Jane will set out the actions we'll be taking to get going on implementation there, but I just wanted to draw formally the board's attention to the fact that that has been published. Thirdly, to give our thanks for the final review that Stephen Bubb has done of the work on the learning disabilities implementation. We've had a number of conversations here about that under Jane's leadership. We've got a clear game plan, including the closure of Courtstones Hospital, 30 to 50% reduction in outmoded inpatient facilities across the country, but thanks to Stephen and his team for the work that they have done. And then she's not here with us today, but I also want to thank Ros Roughton and team for the constructive and successful way in which the 2016-17 negotiation on the GP contract was concluded, with the BMA, and as I said at the time, I think it's a testament to what constructive and flexible negotiation can bring. But it is not obviously the total answer by any means as to what needs to change and improve in general practice, and so we will be bringing forward a comprehensive package of support for GPs shortly in partnership with the Royal College of GPs and the BMA GPs Committee. And in the context of sort of employee-related matters, I also then just finally wanted to draw attention to the fact that this week, on behalf of the National Health Service as a whole, we published the results of the NHS staff survey for 2015. 299,000 members of staff from across the National Health Service gave their views on what it's like to work at their local hospital, ambulance trust, mental health provider, community service, and other places as well. There was some positive news there, as well as some ongoing sources of concern. So 80% of the 299,000 people told us that they do feel able to do their job to a standard that they're personally pleased with, which is up from last year. Staff engagement actually across the health service has been steadily rising over the last 4 years and is the highest it's been in 5 years. And 73% of staff said that their organisation's top priority was indeed patient care, again a further increase from last year. So those are welcome developments, which perhaps were not widely reported. But set against that, there are still far too many staff across the National Health Service who report feeling unsupported at work, on the receiving end of discrimination, bullying or harassment. And the reality is that there are enormous differences between different employers across the National Health Service on those and every other measure that we track in the staff survey. And indeed, within NHS England, we have seen that ourselves. So the work on the workforce race equality standard, the work that we're going to be kicking off next year on incentives for trusts around employee health, and we're going to be launching a new incentive scheme to that effect next week, will all, I think, help move the dial on some of those. The rest, I think, we will be covering in the other items of the board papers. Thanks.
Thanks, Simon. Any questions for Simon? Simon, I have a couple. On the staff survey, and in particular sort of the NHS England element of the staff satisfaction survey, perhaps you could just let us know how you're handling it, what are the major initiatives that you're putting in place as part of that.
Sure, and I might turn to Karen in a moment as well, but there are a set of national things where we continue to raise our game, and there are some big differences between different teams across the country as well in what those survey results look like. So we've got a set of things to do for the organisation as a whole. We have seen some recent improvements in scores after the impact of the redundancies and the downsizing programme that we had last year. But we still see some pretty big differences between teams around the country as well. So Karen is leading that for us. Karen, do you want to?
Yes, absolutely. So there are definitely some things that staff are concerned about in terms of corporate services, and we have a number of things that we are hoping to start to really make a difference to staff in the very near future in the next few weeks, which are improvements in recruitment process and timescales, improvements in procurement processes and timescales, which are things that are just getting in the way of staff working effectively. So we've made a lot of progress on those. On the more sort of substantive issues about how well staff feel supported and engaged by their managers and by their organisation, we've been doing quite a lot in terms of trying to have the right conversations with staff. And we had, for example, a very good session at our leadership forum with our top 120 managers to talk about the impacts of bullying and what we might do about that, which made, I think, a big difference. I think that's really an important part. And we're having conversations with directors not because mainly because obviously directors are the people who really need to care about their staff and work on how they support, engage their staff. So this is about us investing time, management time in staff and supporting them, understanding their concerns, and then dealing with them. And I think that that probably is the most important thing that we can do going forward, and that's what we're, I think, making some progress on.
And Moira, you're on our behalf providing some input and oversight on this particular vital subject. Good, thank you. Yeah, I think it's self-evident, but when the pressure is highest, when the demands are at their most intense, actually one of the things that can often get left behind is the care, welfare and engagement and communication with our colleagues, and yet that's the thing that can actually help us deliver when the times are at their most intense. So I'd really encourage you to be, and with the directors and with their immediate teams, to recognise that's not a cost, that's an investment, and will actually help in delivery. So okay, we'll come back to this subject, no doubt. My other question, Simon, is obviously, you know, the GP programme is at the heart of a lot of the changes. It's where, again, the pressure can be most intense. When is it likely that we'll have a conversation around the package that we can put in place?
We, without kind of prejudging exactly the timings on this, I would hope that we will have a package that has the support of key partners within the next 6 to 8 weeks. So we will take the opportunity to discuss elements of that before that, obviously.
And therefore, in 3 months, 4 months, we'll bring it back to here to for a discussion, no doubt.
Yeah, I would certainly like this published in so-called spring.
Lovely. Okay. Thank you.